In this video, I will describe the research I've performed as well as the CPLEX and heuristic VBA code I've written in order to solve an allocation problem in an emergency room during a time of high overallocation of staff. In this presentation, I will first discuss the problem, then how we will prioritize patients, the simulated annealing algorithm, the CPLEX code for optimization and how they are related, as well as the results of the tests and lessons learned. When large accidents or emergencies occur, there's generally an extremely large influx of patients in all emergency rooms within at least 100 miles of the event. Being that these events are never planned, there is often a very high shortage of hospital staff to allocate to the treatment of various patients. Due to the fact that the hospital staff is under an unusual amount of stress while their time is severely overallocated, patients who require the highest quality of treatment may not receive this treatment. Furthermore, it is highly vital that patients whom are in critical care be treated with the highest priority, while the patients who do not sustain immediate or life-threatening injuries are treated after the emergent situations resides. Through this research, two algorithms have been developed in order to minimize the time it takes to treat all patients, as well as minimizing the time it takes to treat the patient with the maximum required amount of treatment time. In order to determine the patients that require the greatest amount of immediate attention, a scale from 1 to 5 has been developed to classify the patient need. If a patient is classified as a 5, they are likely in highly critical condition, sustaining injuries that leave them unresponsive, and there may be sufficient evidence of a brain injury. A patient that has been classified as a categorical 1 priority may sustain minor injuries such as small wounds that are in need of stitches. The staff will be allocated to patients based on need and their own qualifications. For example, a plastic surgeon may be allocated to a Category 1 patient that has an injury that will need professional sutures performed, while a trauma surgeon will be allocated to a Categorical 5 patient that sustains more severe injury. Using the reference pseudocode, a simulated annealing approach was used in order to formulate a heuristic method of solving the given problem. According to the cited source, simulated annealing is a probabilistic technique for approximating the global optimum of a given function. Specifically, it is a meta-heuristic to approximate global optimization in a large search space. It is often used when the search space is discrete. For problems where finding an appropriate global optimum is more important than finding a precise local optimum in a fixed amount of time, simulated annealing may be preferable to alternatives such as gradient descent. Throughout this project, I decided to use a different algorithm when solving through a heuristic method than using CPLEX in order to combine the benefits of both softwares. In the simulated annealing model, I was able to determine the proper diagnosis of patients and the priority at which they should be set in order to input these figures into CPLEX. The program finds a minimum for the total time it takes to treat all patients that are brought into the hospital. The most appropriate priority was allocated to each patient by constraining the priority of the patient to not have a higher value than the number of hospital staff necessary for this patient. For example, a patient that has very minimal injury and requires very few staff will properly be given a low priority, likely of value that between 1 and 2, while a patient that has very high need for extensive attention from the staff will be given a much higher priority, likely of a value greater than 4. After inputting the priorities results generated from the simulated annealing, we were able to optimize the sequence in which the staff treats patients. This program minimizes the maximum amount of time it takes to treat a single patient. In other words, this will determine the maximum amount of time it takes to treat a single patient and attempt to minimize that value as much as possible. In this example, there may be overlap in multiple staff treating a single patient at the same time. However, there may not be overlap in the staff treating multiple patients at once. This CPLEX code determines the most optimal sequence for each of the staff members to treat the patients in order to ensure patients with critical or emergent needs are treated immediately. Now I will demonstrate running the simulated annealing model copying the generated data into Cplex, and then running the Cplex model. As you can see, using the most optimal sequence and the priorities generated by the simulated annealing model, the maximum amount of treatment time required by a patient is about 47 minutes, and the simulated annealing model determined that it would take approximately 350 minutes to treat all patients. Being that the simulated annealing method incorporates random generation of values, the results differ each time the program is run. The figure on the right shows the times at which each staff member will complete treating the patients that they have been allocated. Using this sequence, the maximum amount of time that will be spent treating a single patient is about 47 minutes. Furthermore, the total time treating all patients as determined by the simulated annealing method is about 303 minutes. Throughout the research of this project, I've learned the vitality of using tuples when developing programs that will optimize using various categorical and continuous variables. Also, I've come to notice the effectiveness of a random generation of numbers in searching for the global minimum rather than the local minimum. When searching for a global optimum, the accuracy of the model will likely only differ by an insignificant figure, while the local optimum will likely differ a significant amount when using a random number generation method.